Welcome to part 2 of our note writing series. In this section, we will deal with the progress note. Similar to the last section, our objectives for this lesson will be to develop a systemic approach to note writing, identify key elements of the progress note and how they differ from the H&P, and describe common pitfalls in note writing. Let's start by discussing the summary statement. The summary statement is a brief 1 to 2 line summation of the reason that the patient is admitted. Pause here to look at a couple of examples of summary statements. The summary statement should not be the same as your assessment in the problem list and plan section. It should be a true one-liner that summarizes your patient. Additionally, it's important to keep your summary statement up to date. Don't just copy and forward. It's not uncommon to see summary statements carried forward with the incorrect patient age or out-of-date diagnostic information. Several attendings choose to skip the summary statement altogether. It's not required for billing and repeats some of the same information that's already included in the assessment and plan. Thus, some see it as an unnecessary step that is prone to errors. Here are 2 examples of a summary statement for the same patient. See if you can spot the errors corrected in the second example. In the next slide, we'll go over these together. These examples are based on a real-life patient. In the first example, the writer has copy-forwarded the summary statement throughout the hospital course. However, looking at the second example, you can see that while the patient's been in the hospital, they've aged from 1 month to 2 months. And so the second example shows the corrected age. Additionally, you can see in the first example that the writer used unapproved abbreviations. And in the second example, the summary statement has been updated to include more detailed and up-to-date information. Now, let's move on to interval history. The name here says it all. The interval history is the place for you to write all of the important things that have happened since your last note. This includes new events since yesterday, vital signs, intake and output, labs, imaging, and the discussion you had with the staff and family. Here is one example of an interval history. I'll give you a moment to pause in case you want some time to review it. And here's another example. Again, you can pause if you want some time to review. Not to sound like a broken record, but again, you do not want to duplicate work in your interval history. A common error is writing plans or exam findings in this section. That comes later in the note. On the flip side, make sure you're writing enough. Avoid prohibited abbreviations and include all of the relevant interval history. Here are a couple of examples of what not to do. I'll give you a moment to pause and think about how you would revise these histories. Now let's review them together. In the first example, you can see that there are prohibited abbreviations and there's not much information provided. Now let's take a look at the second example. The writer starts off by telling us that the patient had a seizure. They tell us how long it lasted, what it looked like, and what was done. This is all great information. However, they then include some information about the plan that neurology gave. We already talked about how you don't want to include the plan here because you're already writing that later in the note in the plan section, and you don't want to duplicate work. Then, after talking a little bit about the plan, the writer goes on to talk about how the patient looked in the morning and includes some physical exam information. Again, these things go later in the note in the physical exam, so you don't need to include them here. We already covered the physical exam in the H&P video, so we will not repeat it here. See that video for more details. As with the H&P physical exam, be cautious when using pre-filled templates. Also, remember to be mindful of copy forwarding. During long hospital courses, the physical exam can be copy forwarded for weeks, leaving in outdated information. For example, the exam can say that a baby has an NG tube when it's already been removed, or it can mention injuries that have already healed. Medications, allergies, labs, and images were also previously covered in the H&P video. See that video if you need a refresher. The assessment and plan was also covered in the previous video. However, I would like to touch on a few key differences for progress note assessments here. As a reminder, the assessment and plan are the most important elements of your note. These are the parts of the note that other providers are most likely to read. This is where you explain who the patient is, how they're doing, what you think is going on, what you plan to do, and why you want to do it. However, the progress note assessment and plan should not be the same as that in the H&P. As the patient's hospital course progresses, their differential should narrow. Keep information up to date and don't copy forward things that are no longer relevant. Avoid note bloat. Let's look at an example of an H&P assessment from the last video and work through how we would update this as the hospital course progresses. I'll give you a minute here to pause if you want to reread this example. Let's imagine you're continuing to follow that patient 48 hours after admitting them. The patient now has a urine culture that's growing 100,000 CFU of E. coli. Antibiotic susceptibilities are still pending. Blood and CSF cultures are negative. You can pause here to look at how the statement has been updated. First, we've updated the age of the patient to 22 days old. Then, we've narrowed our differential with the newly available information. And lastly, we've given our updated assessment of how the patient is doing. For a detailed review of how to write the plan, see the previous presentation. Remember to add new problems and systems as they're identified and remove those that have been resolved. Don't just copy forward your plan and add on new information every day. Your plan should not become a history of the entire hospitalization. It's okay and in fact completely necessary to delete things that are no longer relevant. If you want to make sure that historical information is included somewhere and isn't lost or forgotten, then you should update that information in the discharge summary. This concludes our lesson on writing progress notes. As always, please email with questions or comments.